Hi guys, how are you doing? So today I wanted to talk about the two disorders, borderline and bipolar, that get mixed up pretty often and people get misdiagnosed, especially until recently when borderline personality disorder was not as well recognized. A lot of the time people got misdiagnosed with bipolar type 2 and actually vice versa. So I will go quite quickly through both illnesses and their symptoms and what the differences and the similarities are so that you maybe understand it a little bit better. Actually, I have borderline personality disorder and I speak about it a lot, so I can talk from experience, and I have read a lot of books and articles on it, and I don't know much about bipolar disorder. I know a little bit because I just read about it because I was interested, but obviously I don't have it. I cannot tell you how it feels from the first hand perspective. So, well, basically the two main differences are that borderline personality disorder is, you can see from the name of it, is a personality disorder, and bipolar disorder is an affective disorder, which puts them in two different categories, and there are several differences. So in borderline personality disorder, people mainly struggle with relationships. So their emotions are triggered by something that really happens. It might be overreacting, it might be it might be not even really happening, but just happening in their heads, but it happens as a reaction to something. So with borderline personality disorder, you are affected by relationships, you struggle with emotional connections, and you just struggle with understanding other people and making other people understand you, basically. And your moods can switch really fast. It can happen within a day. You can go from feeling really depressed to feeling really happy to feeling really angry, and it can be really, really, really fast, but it's always triggered by something external, that by something that really happened. So it's just not knowing how to kind of center in yourself and how to cope with your emotions, because they are just way too intense and way too irrational, and they change way too quickly, and sometimes they are not even correspondent to the events in your life. But anyway, borderline personality is all about reaction. Bipolar disorder is an affective disorder, and it is all biochemical, so it happens no matter what happens in your life. So if you are going to have a mania, and bipolar disorder is characterized by the repetitive cycle of manias and depressions, and there can be periods between them where the person kind of is in the middle of it. So they are their regular normal selves and they know who they really are, unlike the borderline personality disorder people who struggle with the sense of identity, and they don't really have this notion of how to come back to the center, because they don't have this center and they don't have anything to come back to, if you understand what I'm talking about. So in bipolar disorder, your manias and depressions are mostly caused by the chemical imbalance in your brain, and bipolar disorder is mostly inherited. So basically, you cannot do anything about it, and they are just going to happen. So the two differences between them in treatment is that you cannot treat borderline personality disorder with pills, because you can only aid the therapy with it. So you can take antidepressants or mood stabilizers, antipsychotics, just in order to kind of stabilize the person when the therapy is happening, because talk therapy and psychotherapy is the most helpful thing for a borderline personality disorder person. And in bipolar disorder, the only thing that you can do is to take pills, and therapy doesn't actually help the manias and depressions because it just happens in your brain and you can only alter it chemically. But therapy is often used just to cope with the things that you do when you have a mania, because in mania people are a lot like the borderline personality disorder people. So they are overly emotional, they are overreactive, they get a sense of this almightiness, they make plans that they are never going to fulfill, they buy stuff that they cannot afford, and they do reckless things like the people with borderline personality disorder. But then when the depression comes, they kind of start regretting it, they cannot do anything, they cannot even leave the house, and it just becomes more and more miserable for the person who has bipolar. And as for the people with borderline personality disorder, they are always overreactive. They, as I said, they don't really know who they are, and they don't know how to come back to this state of inner peace, because they never knew what inner peace is in the first place. And usually borderline personality disorder is triggered by some trauma in childhood, most of the times, not all of the time. Sometimes it is genetic or inherited, but bipolar disorder cannot be caused by an event in your life or like a trauma, because it's an inherited thing. Okay, so I think that was probably it. If I forgot something, then please tell me in the comments. I really like to read your thoughts and to hear about your experiences. I love you guys so much, and thank you so much for watching my video, and see you in the next one. I love you. Be a nice human.